Hi, I'm Laura Fragodt, and I'm one of the 19 students doing their whole year in Des Moines for my M3 year. And I'm just going to talk to you a little bit about the surgery rotation here in Des Moines. So just kind of as a general overview, the rotation is set up as two 3-week blocks. One of those blocks you'll be doing general surgery, and then the other you'll be doing either vascular or pediatrics, and that's just a random assignment that you'll get when you come here. Your typical day starts out at around 5:45 to 6 o'clock. That's when formal rounds are, but you may need to come in, or I shouldn't say you may need to, you will need to come in a little bit earlier to do pre-rounding depending on how many patients you have. So that's kind of the daily schedule, and then OR time starts at about 7 a.m. As far as other things in the rotation, there's also a PBA, there's some afternoon activities, you do one presentation, and then you have a shelf exam at the end. As far as the strengths for the rotation here in Des Moines, one of the things that I really appreciated, even though I'm most likely going into internal medicine, was the amount of time that you spend in the OR. You don't do a lot of clinic here in Des Moines, but I kind of see that as a strength because you just get as much exposure to that OR that you possibly can, and that's something that, especially for me, I'm never going to see again. Or if you want to go into surgery, that's a great experience for you to build on your surgical skills. And the other thing that I really enjoyed is that I felt like I got quite a bit of practice doing suturing and other skills. Sometimes I would ask the anesthesiologist if I could intubate, and they were often willing to let me do that. And one day I was able to sew up a whole side of a mastectomy by myself. So that was really exciting and kind of empowering to be able to do. As far as general tips go for the surgery rotation, some things that I would say are do your Pistana reviews. Know that stuff really well. That'll help you out on the test a lot, and they'll give you that here in your rotation in Des Moines. Some other things for the OR, use surgical recall, maybe study a little bit of the netter's anatomy for your cases, and that'll really help you shine in the OR for your attendings. And then as a final thing, just really try to help out in the OR as much as you can. You can kind of gauge within the first few days what types of things you can do, but you can help by changing people's positions when they're on the OR table or putting in Foley catheters, and just be as engaged as possible in that setting, and I think you'll do well on your surgery rotation. So if you have any more questions, just talk to Wendy or Dr. Craig. Their emails and contact information are on the website, and best of luck next year.